Far too many people are barely holding on just by a string. They're embarrassed that they no longer feel strong enough to hold up the weight that's bogging them down, and they don't want to burden their family. They don't want to be a weight to their friends. July is Minority Mental Health Month. As lead therapists at the Up Company, we no longer want you to be good at suffering. We no longer want you to feel you have to paint a smile on your face when it's a struggle day to day. So today, we're going to have a chat about medication for mental health in the Black community. We're going to talk to an expert and get our questions answered. We're going to speak with Dr. Sashalee Stewart of Avance Psychiatry. Well, hello, I am here with Dr. Sashalee Stewart. I'm so excited to chat with you. I'm Natasha Oates with the Up Company, and I have some questions for the people for you.
All right, ready to answer.
So how did you get into this field of helping people through psychiatry? How did you get to this place?
Very good question. When I started out, I always knew that I wanted to be a physician, but psychiatry was not where I started out. So I thought for the longest that I was going to be an OBGYN. And throughout the course of my journey, whenever people would ask me, why is it that you want to be an OBGYN? I would always say, because these women are going to see me more frequently than they would probably any other provider. And then they'll want to tell me really what's going on with them. And then so the more that I thought about it, the more I was like, you know what? I think I want to do psychiatry, and I really want to just kind of work with people, helping them to kind of work through their issues and their problems, their struggles. Yeah. And so along the way, I always knew that I kind of wanted to marry both things, just the OBGYN piece of things with, you know, psychiatry. And there were certain things that have come up in my life that allowed me to really strengthen that. So I've had relatives that have had multiple pregnancy losses. Wow. I had a family member who, you know, unfortunately took their own life. And I remember when that even happened, I was like, we're Jamaican, like we don't do that. That's not something that we face. And so that was kind of hard for me. And I really saw that there was a need for, you know, us to learn more and get more educated on what is available and what's out there for us. Wow. And for me to be able to kind of step in and meet that need.
Wow, what a journey. What a journey. So starting from wanting to take care of women through being an OBGYN to having your own personal experiences with multiple losses of you know, babies and dying, a family member or a close loved one dying by suicide. And I think y'all all heard of that. Like, we don't do that in our community. That's what we believe. That's what we hold on to. But that might also keep us sick.
Right.
And not getting the help that we need. So absolutely. I'm so glad you've decided to become and be a psychiatrist and offer, you know, phenomenal services.
Thank you. Yeah. It's been life-changing for me as well. Just every day coming into the office and seeing lives actually get changed and helping people. And though I don't really hone in on only seeing women, now I see both women and men. Okay. Women's mental health is still my passion.
We're going to give love to the men as well. We care about you as well. So you see both.
Yes.
Okay. Beautiful. So what would you say to people who they have these certain beliefs about taking medication for mental health that, you know, it's not that bad, you know, what beliefs have you had to help people work through because you knew that medication would be the game changer for them? What beliefs have you had to dismantle?
So there are quite a few. Okay. So first, there's some of the kind of historic perspectives that have been out there. I remember one of the patients that I saw during my training in the emergency department, she came in and was even talking to me about her hesitancy not only with just healthcare in general, also just mental health care, but because of her fears and her thoughts about like the Tuskegee trials and the Tuskegee studies.
Yeah.
And we had to kind of work through that and talk through that and figure that out. So on top of that, then there's just a general stigma across the board with people not wanting to seem like they're crazy
Right.
to seek mental health care, much less then take medication on top of that.
Right.
And though I think generally across the board, some of that stigma is kind of being dismantled a little bit, but I do feel like in our community, we're a little bit slow to accept all of that.
Sure.
And so there's a lot of apprehension because of everything that has gone on. So that part of it kind of makes sense. And the cultural aspect of things, there's some hesitance there as well because we're supposed to be strong and we just pray about things and we just push through. And we don't have to suffer in silence, right? So there are other ways of thinking and of being. And so there's a lot of guilt that's associated with that as well, seeking care from people because of what they've heard every day of their lives, that you just need to be stronger. And it's weakness to take this medication. That means that you can't hack it. You can't deal with things on your own, when that's not necessarily the truth either.
Yeah. Let me unpack what you're saying, because
woo.
Okay. So you mentioned guilt.
Yes.
There's a guilt factor that you're supposed to be strong enough to handle this. And I hear with my clients too, my life is too good for me to have any mental health issues.
Yes.
So that's so real. Thank you for highlighting that.
Absolutely. And I think one of the ways that I try to explain that to people when they come and see me is to say, what is the strongest computer that we have known to man? It's our brain. That's the thing that tells all of this to function. So that tells our heart to beat, that sends what we need if we get a cut, so that we don't bleed everywhere. And so for us to then say, we can't stop and say, okay, I'm going to slow my heart rate down in 3, 2, 1. We can't do that, right? So sometimes we might get a cut. We could put a Band-Aid on it. We're good. Sometimes it's a little bit deeper than that, and we have to go to a hospital and we need to get stitches. So sometimes we might not feel well and we feel a little bit down. We can, change our habits, do this, do that, and deal with it on our own. But sometimes it's a little bit deeper than that. And we do have to go and either talk to somebody or get medication to actually help that, because we can't control this supercomputer that is our brain.
Well said.
Yeah.
Well said. Sometimes it's deeper.
It is deeper than
Sometimes we need much more than what we typically would. And you're helping people have the courage to take that step.
Absolutely.
Let's do that even further. So could you describe, and of course, keeping people's privacy private, what have you seen? What difference have you seen in your patients from when they walked through the door, they were experiencing, maybe a moderate to severe mental health condition, to when you got them on the medication that worked well for them? What have you seen in your work?
Yeah. I mean, there can be some profound changes in people, from somebody that's not really able to get out of bed, or they're getting out of bed, but they are just, every step, it's like lead lifting up their foot to take the next step, to them then feeling like they don't have to isolate from people and stay by themselves all the time. And they're able to get out there and they're actually living their life and not just surviving each day, because that is something that people will say, I just feel like I'm surviving. And that's not life. You're not living your life. And for somebody to be able to have an opportunity to take a medication, or sometimes it doesn't need to be medication, but to take something or have a treatment for them that is actually that beneficial to turn their lives around, I think that is powerful. And I feel like sometimes we are not accessing everything that is actually out there and available to us because of kind of these preconceived notions that we have in our minds. Another one of the things that I encourage patients to do is find someone. So it doesn't necessarily, I'm not asking people to shout it off the rooftop to say that they're dealing with, any sort of mental health challenge.
Right.
But find somebody in your life and talk to them when you're having a bad day. Because sometimes when I ask people about their supports, they're like, oh, well, I have these people, but I just don't want to tell them what's going on with me. I don't want them to know. I don't want them to think of me in any other way.
Yeah.
And several patients that have come back to me that they will say, I talked to my sister and she actually said she's on medication and has been on medication for years and is seeing a therapist. I had no idea.
Wow.
And so then we realized that we're not alone. We don't have to do this alone because we've all experienced some level of anxiety, some level of depression, whether it's in yourself or with somebody that you love or you care about. We experience it even when we don't want to acknowledge it. But if we talk to each other, then we can kind of find the strength in numbers and be there to encourage each other through those things.
Wow. So you've really seen like the dramatic differences between I can barely put one foot in front of the other to I feel so much better. And I love your advocacy around getting out of staying silent and isolated.
Yes.
Like feeling like we have to do it on our own when really we need our community for healing. And I got to tell you, I see a lot of Black and brown clients. Y'all going to therapy, so stop hiding. Come on out. We have to have conversations like this so that it's okay.
Yeah.
What would you say to someone who, they've been on a struggle bus? They wear, they're a survivor. We sometimes wear that with a badge of honor, that we can survive and we can put one foot in front of the other. But for that person that says, how do I know it's time to maybe seek out a consultation with a psychiatrist? What would you say they can be on the lookout for, that this might be some signs to take that step, to be, courageous enough to do that?
Yeah. I mean, if you feel like you are struggling with things and you are falling into this rut where you're feeling down, you're not able to get out of that as easily as you once were able to. You're not really finding joy in anything in your life anymore, and you just are going on this spiral, it seems. Then you want to seek some sort of consultation and find some information in that way, right? So in a consultation, so what I always tell my patients as well is, sure, I come as the expert on the medications, but you are going to come as the expert in you. And we have to meet someplace in the middle. Whatever it is that I say is simply a recommendation. You can have a consultation, and if someone recommends medication or anything else, you can always say, okay, I'm considering that. Or if you don't feel like that's something that's for you, then that's not for you, but at least hear what that person has to say, hear what there is that they have to offer to you. Because it could be the matter of, in some cases, life and death.
So true. So true. Tell me what you mean by that. Like, consider the recommendation, take the step. It could mean life or death. What do you mean by that?
So sometimes, I mean, death doesn't even have to be in the literal sense of, we are no longer here anymore. Wow. But just the death of your life, what your life could be, what potential you could have is now lost because you are making a decision to not take ownership of your life and putting you as a first step. And I feel like a lot of people, again, that word guilt, feel guilty about doing that because I have so many other people in my life that I need to take care of, and I'm, watching over. Why would I can't take care of myself? Like, I'm on the back burner. But if you're not doing well, you really can't help these other people. And if you're not here and you're not either mentally or physically able to help them, then it's all for not really anything, right? So we have to take ourselves in some priority as it relates to our health. And your mental health is a part of the entire system.
Wow. So well said. It's not always about being concerned about suicide, which is a very real issue, but the death of your life.
Yes.
Wow. We can sometimes be so caught up in how we're helping other people, our family members, our friends, that we lose our own life.
Yes.
So this is a wake-up call. I know y'all are listening. This is such an incredible conversation. I want to make sure that people know how to, if they want to reach out to you, if they want to set up a consultation, that they would know how to do so. Would you share the best ways for them to reach out to you?
So just going to our website, avancepsychiatry.com. On that first homepage, there is a contact information sheet where you just kind of fill out your contact information. Somebody will reach back out to you at that point to schedule an appointment.
Okay, excellent. Well, y'all heard it. So go to that site, schedule that appointment, be an advocate for your family members who something is off. Maybe they're not saying what it is. Maybe it's you. Maybe you feel guilty that you have such good things in your life, that you are the point person for people. How dare you be dealing with what you're dealing with? So we want to urge you to reach out and get help. July is Minority Mental Health Month. So this is a great time to get started. I'm Natasha Oates, lead therapist at the Up Company. It's been a pleasure chatting with you.
Thank you so much, Natasha.
Thank you so much.